Okay. Namaste and good evening to everyone who has joined us here on the portals of Amity University. We are Amity Legal Aid and Literacy Committee, and also we have an outreach committee. Today's webinar is in collaboration with the Legal Aid and Literacy Committee of Amity University, together with the Legal Aid and Literacy Committee of the University of Jammu Law School. Also, we have collaborated with the United Nations campaign, which empowers the teenage girl across the globe. And we have collaborated with Girl Up Gauravi, pride and honor, because it's when girls rise, we all rise. So before that, let me give you a glimpse about Amity University. Amity University today is 12 universities in India with 16 global campuses. And with 28 schools and preschools, we all follow the ideals and values and the vision of our honorable founder president, Dr. Ashok K. Chauhan sir, who believes that every Amitian should contribute towards nation building and that India will be a knowledge superpower soon. But that is possible only when together we all contribute towards all the pillars of Viksit Bharat. And one of the pillars is women-led development, also focusing on the youth and putting India on the global map. So today's webinar has a genesis on the government schemes and directions. Today's webinar focuses on different government schemes and directions. Say, for example, the Menstrual Hygiene Scheme, which is implemented by the Ministry of Health and Family Welfare under the National Health Mission, Swachh Bharat Mission, which focuses on sanitation improvements, including clean toilets in schools and public places, essential for menstrual hygiene management of the girls and women, girl students, female faculty and staff, and the female management, and the females who are there in the management. Then comes Rashtriya Kishore Swasthya Karyakram, which targets the adolescent health, including menstrual hygiene education, counseling, access to sanitary products. Then National AIDS Control Program, integrating with other health programs, because HIV or AIDS awareness is integrated with the reproductive and adolescent health programs, including school education and adolescent counseling centers. And also, this is all under the legal and policy framework based on the right-based approaches to reduce discrimination, ensuring confidentiality of the people living with AIDS, especially because as per the Indian Constitution, right to life and liberty, every person has a right to live with dignity and honor, and no disease can discriminate a person who is living his life with a disease called HIV AIDS. So today's session will be taken by Dr. Meera Pathak, a very young and very dynamic medical practitioner. Dr. Meera Pathak, MBBS MS in gynecology, is a seasoned medical professional with over 14 years of dedicated service in the Uttar Pradesh Medical Officer at Center for Healthcare, Noida. She has been consistently recognized for her outstanding contributions, receiving multiple awards for excellent services provided at both the districts and the state level. A trusted health expert and a media panelist, Dr. Pathak has been featured in numerous interviews in national television channels, leading print media, and also offering expert insights on women's health and public welfare. So before I formally welcome Dr. Meera Pathak, ma'am, I would like to welcome you with this brief profile of yours, which is very beautiful, and I thought that everybody should see this. So welcome to the portals of Amity University. And here we go. This is Dr. Meera Pathak. Welcome, Dr. Meera Pathak. Welcome to the portals of Amity University, a research and innovation-driven university, and also which focuses very deeply on women education, women safety, security, and women health, because Swasth Beti se banega Swasth Bharat. Welcome, Dr. Meera Pathak. And I will also request Monica Narang ma'am to welcome Dr. Meera Pathak with a few words.
It's a great pleasure, ma'am, that you to have you here. And I first of all I congratulate Dr. Sumitra, who's associate professor in Amity Law School, Noida, uh, to organize this program, and because it's a very typical topic which people generally don't talk about, and various taboos are linked with that. And I think this is an area, ma'am, which you would highlight, and which is going to help students also, the younger generation, that to come out with some good say initiatives regarding that, the awareness program on this menstruation, the and what type of diseases it can lead to if the proper care is not taken. So it's a great say honor for us to have you here, ma'am. We welcome you in collaboration with the Amity Law School and the Law School Jammu University. Legal Aid and Legal Literacy Committee is organizing this program. Uh, Welcome, ma'am.
Thank you.
Good evening, everyone. It's an
Yeah,
absolute honor.
before that, Dr. Meera, I would like to really thank Monica, ma'am. Actually, they have a very big seminar tomorrow, and everybody is preparing for that. And that is
Yes.
also one of the services that they're offering to the country. That is about Nasha Mukt Bharat, जो हमारा भी
Wow.
program अभी होने वाला है. So it is now over to Dr. Meera Pathak, our guest speaker. I'll request you, Dr. Meera, that you also continue with your guest lecture along with an interactive session. I think that will be the best for everyone. Over to you, Dr. Meera.
Good evening, everyone. It's an absolute honor and absolute pleasure to be here amongst you all. And I thank you so much for this lovely, beautiful introduction. And as you all know, today we will be having a session about menstrual hygiene and HIV and AIDS awareness. And both these topics are actually very, very understated, but very, very important topics. And it is actually a very sad fact that though our society has progressed so much, there's still a lot of shame, stigma, and taboo associated about these topics. And these topics are not easily discussed, openly discussed. And wherever there is silence regarding certain topics, what happens is that there are a lot of myths and there is a lot of misinformation and fears regarding these topics. So today, through this session, it is my endeavor that I provide information which is relevant and correct, and I try to break those myths. And it will also be my endeavor to answer all those questions which are commonly asked by youngsters and students from me. And it will be an interactive session where I look forward to asking questions and answering questions as and whatever they may be. So not without any further ado, let's start with the session, if that's possible. So as you all know, we are starting the session on let's talk about menstrual hygiene and AIDS and HIV awareness. So we will start with the section on talking about menstrual hygiene. And let's just talk about what are the topics that we will be covering in this session. The first topic will be about menstruation, a quick refresher. I know that we all know quite a lot about the menstrual cycle, but it is important to know what is a normal menstrual cycle so that whenever there is an abnormality or irregularity, we are able to detect it quickly and we are able to find the right guidance about it. Second, we will be covering period products. What are the smart choices for period care? And third, we will be talking about hygiene 101, why we require, what is the requirement of menstrual hygiene, what is the importance of menstrual hygiene, what are the do's and don'ts associated with menstrual hygiene. So let's start with introduction to the menstrual cycle. As we all know, a normal menstrual cycle is a normal physiological process. It happens, it is a normal physiological process which is based upon the cyclical shedding of the endometrial lining. Whenever we are born with a fixed number of eggs in our ovaries, and every month one egg is released from each ovary. This starts happening at the time of puberty, which is on an average at around 10 to 12 years of age. At 10 to 12 years of age, the ovaries start producing eggs, and the uterine lining or the endometrial lining, it starts getting thickened to receive that egg which has matured, so that in any case there is a conception or fertilization, the egg can embed in the endometrial lining, in which case we start having a delay in the periods and we start missing periods. But in the case that there is no conception, no fertilization, the egg sheds off, and when the egg sheds off, the endometrial lining also sheds off in the form of menstruation. Now, the average age of onset is around 10 to 12 years, but if the periods start before 8 years of age or do not start by 15 years of age, it is a matter of concern, and it is a time when you should visit your doctor. Then, what is the normal menstrual cycle? The thing is that what is the duration of a menstrual cycle? The normal duration of a menstrual cycle is 21 to 35 days average. The question that most people ask at this time is that when do we know that there is a delay in the menstrual cycle? And if a woman is sexually active, the question which is generally asked is, when do I check for pregnancy? When do I check for a urine for pregnancy test? In this case, a gap, a delay of 7 days is normally a physiological delay. So we do not check till 7 days are beyond, till there is a delay of 7 days. And if there is a delay of beyond 7 days, then a urine for pregnancy test should be done. However, if the periods are regular, and they are so regular that if there is a delay of 2 to 3 days and the girl or the woman wants to check whether she's pregnant, a urine for pregnancy test may be false negative. At that time, it is important to get a blood test for pregnancy done, which will be more accurate. Because sometimes what happens is that post 2 to 3 days of delay, they get a urine for pregnancy test done, and the test is negative, and there is a false sense of security, or maybe there is a false sense of hope at that time. So what you have to do is that you have to repeat it if the delay is beyond 7 days, or if you want to go for it and check, then you should get a blood test done. The next thing which is there is the duration of periods. Normally, the duration of periods is from 2 to 7 days. A duration of periods for 2 days is also normal, and a duration of periods for 7 days is also normal, because the menstrual cycle of a girl, that is quite unique for every girl. So it can be of 2 days or it can be 7 days. Then about the normal flow, that the flow also varies depending upon the time period of the period, that in the initial stages of the period or the final stages of the period, the flow may be scanty. It might require just 1 to 2 pads. But in the middle of the periods, the flow might be heavy and might require 3 to 5 pads. So what is it? When should we consider that the periods are heavy? We should consider the periods are heavy if it is like 1 to 1.5 hours, you have to change a pad, or heavy clots are being passed. In that case, the flow is heavy, considered to be heavy, and then you should visit a doctor. The next thing and the next question which is commonly asked is, why do we have pain during periods, lower abdominal pain during periods? How much of pain is normal? How much of pain should be when you should consult a doctor? So when we consider about pain during a normal cycle, 60 to 70% of girls may experience some kind of lower abdominal pain or back pain during periods, which is called dysmenorrhea. This is usually because the uterus is cramping to release, it is contracting to shed off the endometrial lining. In this case, usually rest or hot fomentation is enough to treat the pain. But if you find that in spite of rest and hot fomentation, the pain is not being released and the pain is somehow affecting the functioning of the child, then in that circumstance, you should consult a doctor, because there are certain medical conditions like PCOD, or endometriosis, or pelvic inflammatory diseases, which might be responsible for that pain and which require treatment. Then another question which is very commonly asked about dysmenorrhea is the myth regarding painkillers. The myth regarding painkillers is, some people consider that when you take painkillers, you might get addicted to painkillers. So that is a myth. You can never get addicted to painkillers. In fact, painkillers will help you function properly during your periods. Second myth which is associated with painkillers, which I would like to reiterate here, is that tolerance to painkillers. People think that if they start taking painkillers, they might develop a tolerance to painkillers, that they might have to take the painkiller. Initially, a small dose might be enough, and later on, they might have to increase the dose for getting the same amount of pain relief. So there is no tolerance and no addiction associated with painkillers. In fact, taking painkillers helps, because it helps you function properly and it reduces swelling and inflammation inside the uterine organs. So it is actually beneficial to take painkillers. But at this time, what is required and important is that you take painkillers after consulting a doctor. So this was about menstrual cycle, and I would like to invite any questions if there are regarding a menstrual cycle at this time.
I'll request all the girls to put up their questions. However, if the question is not coming up, I have a question, Dr. Meera. So, is dysmenorrhea, is it common for everyone? Like there are people, like ever since, I mean, every girl has periods. So, like there are many friends of mine. They say, no, no, we never have any pain. So, is it that this pain is there for some people and it is not there for some people? Is it normal not to have pain?
Yes. So there is a variation. There is a variation in a normal menstrual cycle. Firstly, a menstrual cycle is unique for every child. Every girl, every woman will have a unique menstrual cycle. The second thing is that there will be variations even in the same woman for regarding a menstrual cycle, because a menstrual cycle is very easily affected by stress. It is affected if a woman does not have a proper sleep pattern. Somehow the sleep pattern gets disturbed. Somehow the diet gets disturbed. Somehow there is a imbalance, slight imbalance in hormones also will start affecting the menstrual cycle. In which case, initially, if there is no pain, she might think that this time around she's having slight discomfort. So slight amount of variation in a menstrual cycle is normal in every woman. But as long as that pain is not causing discomfort to a level where rest and hot fermentation is not helping, or where it is affecting her normal functioning, then in that case, it is physiological. Second thing about the pain is that 60 to 70% of women do experience some kind of pain, but the rest 30% may not experience some kind of pain. And there is another, it's a fact which is associated with dysmenorrhea, that usually it is found that after maturity, as the body matures, the chances of having dysmenorrhea reduces. Actually, it reduces with time. So dysmenorrhea may not be there, it may be there, and it is also quite possible that it was not there, but it has started now. As long as it is a discomfort which can be corrected by just hot fermentation and rest, it is all right. But if it is too much, then you need to consult a doctor.
Also, Dr. Meera, is the pain very localized near the abdomen, lower abdominal region, or it spreads across the body?
Yes. So now this is a very, very good question that you asked, Sumitra ma'am. Definitely the pain which is there is localized in the lower abdomen. It is localized at the back, but it can radiate to the upper thighs. It can even radiate to the legs.
Thank you, ma'am. So I think you can proceed. If anybody has any question, please unmute yourself and ask questions with Dr. Meera. And if you don't want to open your camera, you can type it in the chat box. Over to Dr. Meera now.
Thank you. So now moving forward, let us know period products, because there are a lot of period products which are available in the market, and everybody wants to know more about period products. So let's go ahead and talk about what are the period products which are available in the market. The period products which are available are sanitary pads, cloth pads, tampons, and menstrual cups. Now let's first talk about sanitary pads. Sanitary pads are most commonly used. They are very easy to use. They are very easy to dispose. The good part about sanitary pads is that sanitary pads have adhesive strips which sticks to the underwear and makes sure that the sanitary pads do not move. So it kind of helps during menstruation. Next thing that we all know about sanitary pads is that sanitary pads come in different sizes for different flow levels. And important part about sanitary pads is because at the time of menstruation, there is blood which is there, and blood is a very good medium for bacterial infections. It is important to change the pad every 6 to 8 hours. Otherwise, the blood which is present in the sanitary pads, because there's a warm and moist environment around the genitalia and there is blood, there are chances that there will be bacterial infections. So if we want to save ourselves from bacterial infections, we should change our pads. In fact, every period product should be changed every 6 to 8 hours. So again, the advantage of sanitary pads is that they're easy to use, they're available everywhere, they're easy to dispose also. But the disadvantage of sanitary pads is firstly that they are not eco-friendly. Second thing about sanitary pads is that the reason why some people prefer cloth pads is that sanitary pads might be a little expensive. Now we go towards cloth pads. Cloth pads are reusable pads. Cloth pads are usually used They're made by soft cotton, they are washable, they are reusable, they are made up of sustainable, breathable material. The disadvantage is that, however, it requires to be properly washed and sun-dried to make sure that there is no chance of infection. And there is another disadvantage associated with cloth pads is that they may shift if during movement if they are not secured well. Now, one more reason that most of the people in rural areas or people who are in the low socioeconomic zones use cloth pads is because they are less costly. Here, I would like to add an information which I hope if you can spread it to other people, it will help. Is that in government sector, there are certain centers which are called Jan Aushadhi Kendras. At Jan Aushadhi Kendras, sanitary pads are available at very, very minimal prices. You can get 6 sanitary pads at the cost of 6 rupees. So you can spread this information. There are at least 72 centers of Jan Aushadhi Kendras in Noida itself, and you can find out which Kendra is next to your home or close to your place by Jan Aushadhi Sugam app. So if you use that app, you can help people who are in the lower socioeconomic zones, who are working for you, or yourself, you can get sanitary pads at lower subsidized rates at Jan Aushadhi Kendra. This will help people who are used to using cotton pads to switch over to sanitary pads, because actually cotton pads have a high risk of infection. It is usually not possible to wash them properly to get them to sun dry and expose them to sun. So that is why it is better to switch from cloth pads to sanitary pads. Now, when we talk about the next period product, which nowadays is very commonly being used, is tampons. Tampons are actually inserted into the vagina to absorb flow. Now, since they are to be inserted in the vagina, one very important thing which is required here is a knowledge of the female anatomy. That the girls who want to use tampons should be well aware of the anatomy of female anatomy, that there are 3 openings. One is of the urethra, one is of the vagina, and one is the anal opening. So the tampons have to be inserted in the vaginal opening. The tampons may come with an applicator or without an applicator. They usually have a thread attached to them. And once the periods are over, like it's 4 to 6 hours are over, and you have to change the tampons, you can tug at the thread and remove the tampon and replace it with another tampon. Now, tampons, just like sanitary pads, come with different absorbency levels. The good part about tampons is that they're very comfortable for children who are interested in sports. It is good during swimming, competitive sports. You can use tampons. Tampons are very, very leak proof. But there is one disadvantage which is there, which is that the tampon, since it is inserted in the vagina and since it is absorbing blood, there are chances that it can become a source of infection if it is not replaced every 4 to 6 hours. So very importantly, no matter how much absorption of blood has happened, how much has not happened, whether it is soaked or not, it has to be replaced every 4 to 6 hours. And you must not use tampons at night at all, because the bacterial infection levels which can happen with tampons can reach a stage where the infection can cause toxic shock syndrome, which is a condition which is about fatal. So first and very important thing about tampons is that you can use it. They are leak proof. You can use it during sports, during swimming, but you have to be very careful that the tampons have to be replaced every 4 to 6 hours, firstly. Second, try to use tampons which have lower absorbency levels. And third, you should always have clean hands and you should be comfortable with insertion. This is again another point which is to be required during tampons and even in menstrual cups, that the lady has to be very comfortable with insertion. Practice is required. Now, if we come to the next period product, that is menstrual cups. Nowadays, I'm seeing that a lot of younger generation is switching to tampons and menstrual cups, which is actually a good thing. So menstrual cups are flexible. They are made up of medical grade silicone cup. You have to first visit a gynecologist to understand how to use a menstrual cup. And once you understand and you get used to it, it's fairly easy to use. Now this menstrual cup is inserted into the vagina. It collects blood. It does not absorb blood. And once it fills with blood, you feel a little heaviness. So you can just pinch it and remove it, discard the blood in the toilet, wash it and reuse it again. And if you wash it, keep it properly and nicely in a hygienic manner, you can reuse a menstrual cup for up to 5 to 10 years. This gives it an advantage that a menstrual cup is eco-friendly. It is very eco-friendly, it is very cost-effective also. And a menstrual cup can be used for a little longer duration of time. It can be used at night. But again, you have to have a comfort on how to insert it. It requires practice for insertion and removal. But once you get the hang of it, it is fairly easy to use. So now I would like to invite, if there are any questions regarding period products, I would like to invite those questions right now.
Okay, so if questions are not coming up, I'll take up the questions which feels very close to my heart. So, Dr. Meera, why are tampons and menstrual cups not so popular? Like, ever since I'm seeing that people generally use the pads only. So, why are the tampons and menstrual cups not so popular? And is the government providing certain perspectives on this, or are they providing it for free somewhere or on subsidized rates somewhere, Dr. Meera?
So about tampons and menstrual cups, the disadvantage about tampons and menstrual cups is that it requires the girl and lady to be a little bit more aware about her body. It requires more comfort with her own body. She should be very comfortable with her body. She should. It's a little technical to insert and remove it, but it's just a matter of practice. Once they practice, they can do it easily. Right now, there are no government schemes which are providing subsidized tampons or trying to do menstrual cup wala thing. But the thing which is associated with it is that, you know, tampons have a slightly higher rate about this thing, that they have to be replaced every 4 to 6 hours. And if a girl forgets to do that, then it can lead to a higher chance of bacterial infection. So that is one reason that tampons and menstrual cups are generally, they are a little, and sanitary pads in comparison, they are easier to use, they're easier to dispose. So people prefer sanitary pads over tampons and menstrual cups. Otherwise, there is no reason, because tampons are fairly leak proof and menstrual cups have an advantage that they're eco-friendly. So with girls and women who find it very easy, who are comfortable with their bodies, they can go and visit a doctor, learn how to use it. It is a very good choice.
Thank you, Dr. Meera. Please proceed.
So let's proceed to menstrual hygiene 101. When we start with menstrual hygiene 101, very importantly, what we need to understand is that why we talk so much about menstrual hygiene. Why is menstrual hygiene so important? So why is hygiene important during menstruation? There are two reasons. First is that wherever there are orifices in our body, like the mouth, the nose, and the vagina. Vagina is an area of the body which is in contact with the external environment. So any part of our body which is in contact with the external environment will try to have a defense mechanism. It usually has a defense mechanism to protect itself. And that defense mechanism is in the form of, in the vagina, it is in the form of pH. That is the acidity of the pH. The pH level of the vagina is low. It is 3.5 to 4.5. That makes sure that the bacterial infections do not stick to the vagina. They cannot stay in an acidic environment. But when there is menstruation happening, at that time, because the blood has an alkaline pH, the pH or the acidity, alkalinity of the vagina, it changes. And because of that, it becomes easier for bacterial infections to happen at the time of menstruation. Second thing is that at the time of menstruation, there is blood which is dripping, which is flowing through the vagina. And the blood is a very, very important culture medium for bacteria. So because of these reasons, because of the fact that the acidity of the vagina is low right now, because there is blood in the vagina at this time, there is a moist and warm environment at all times, there are high chances of bacterial infections. So if we do not take care of menstrual hygiene at this time, we can have recurrent infections, we can have bacterial infections, reproductive tract infections. So what are the dangers which can happen? First is urinary tract infections. There is high chance of urinary tract infections if we do not maintain menstrual hygiene. So there are high chances of urinary tract infections. There are high chances of reproductive tract infections. Now here I would like to explain what is the difference between a urinary tract infection and a reproductive tract infection. The urinary tract is different. The urinary tract includes the excretory system, includes kidneys, the ureters, the urinary bladder, the urethra. So whenever there is a urinary tract infection, and we females and males both have the same excretory organs, but females are at a higher risk to have urinary tract infections because they have a shorter urethra. So when there is a urinary tract infection, the female will have symptoms of hesitancy. Hesitancy as in when you try to go and urinate, you find it difficult to urinate. You feel like going to urinate, you feel like urinating, but you're not able to pass urine. That is hesitancy. Frequency, that you feel like going to the washroom again and again. You feel like I just went to the washroom, I came back, but I still feel like kuch reh gaya hai, thoda sa urine aur karna hai. Then you go back to the washroom, you try, you urinate a little bit, but you come back, you still feel that there is an urgency that you want to urinate again. So these symptoms, hesitancy, frequency, and burning situation, that you feel that the urine is burning. And there can be fever and lower abdominal pain. So this is a urinary tract infection. In contrast, a reproductive tract infection is a part which is affecting, these are infections which are affecting our reproductive tract. The reproductive tract is made up of the vagina, the uterus, the tubes, and ovaries. So in reproductive tract infections, normally there is a burning, there is itching, there are rashes, there can be sores on the genitalia. The genitalia is affected and there is discharge. Normally vaginal discharge happens, a little bit of vaginal discharge happens because the vagina cleans itself. But this discharge in an infection is foul smelling and it is excessive and copious. So this is how you differentiate between a reproductive tract infection and a urinary tract infection. That a urinary tract infection, there will be burning, there will be feeling of going to the washroom again and again, you're not able to pass urine, you keep having lower abdominal pain and fever. In a reproductive tract infection, you feel that there's a lot of vaginal discharge which is happening and it is causing foul smelling. So these two infections become very high chances of these infections if we do not maintain menstrual hygiene. Next is skin rashes. Most of the girls have these problems that their thighs have raw areas because of infection. So this is skin rashes can take place. And if we do not take care of reproductive tract infections, if we do not treat them in time, if we do not prevent them from happening, we can have infertility. Infertility is because the infection can travel from the vagina to the uterus. From there, it can travel to the tubes, and the tubes can get blocked because of the infection. So later on, reproductive tract infections can lead to infertility, and they can even lead to cancers like cervical cancer and endometrial cancer. Now, knowing all this, let's go ahead and find out what are the do's and don'ts of menstrual hygiene. In the do's of menstrual hygiene, what we need to do is that before changing or applying period products, we need to wash our hands because our hands have been contaminated by the external environment. If we use period products without washing our hands, we are ourselves introducing infection into our bodies. After using the period products, discarding the old ones, applying the new period product, we should wash our hands again because now our hands are infected with the blood, the menstrual blood, and now our hands are dirty. We can pass that infection outside. So we need to wash our hands before using period products and after using period products. And we should not handle menstrual products with dirty hands because of the same reason. Second is very important that every period product, whether it is a sanitary pad, whether it is a tampon, whether it's a cloth pad, every period product must be changed every 4 to 6 hours. Again, it is because if blood stays for that long in contact with the body, it will itself become a source of infection for the body. So we need to keep changing period products every 4 to 6 hours. And most important in the don'ts is that sometimes we feel that, you know, the period product has not been soaked enough. We can keep wearing it for 8 hours. We can keep, we may not change our sanitary pads for like 8 hours or 12 hours. Ki abhi to itna soak hua hi nahi hai. It has not been soaked that much. Why do I need to change it? So we should not use our sanitary pads, whether they are soaked or whether they are not soaked with blood, more than 8 hours at least. And for tampons, not more than 6 hours. Next is an important and very important thing here is to wash the genital area. Normally there is a myth which is surrounding menstruation that don't take a bath during this time. So this is very important that at least once a day, during menstruation, at least once a day, you should take a bath. Every time you go to the washroom, please wash your genitalia. The genitalia should be washed with simple water. or mild soaps are also okay. But we do not use harsh soaps. We do not use intimate washes or deodorants near the genital area. Now, here there is a lot of questions which come from the younger generation about V washes. There are vaginal washes which are available in the market. Whether these vaginal washes should be used frequently, whether these vaginal washes should be used daily, whether these vaginal washes should not be used at all. Vaginal washes which are there available in the market usually should be used only occasionally. They should not be used regularly. Why? Why they should not be used regularly? It is number one, because most of the vaginal washes have antibiotics in them, or they have harsh chemicals in them, or they have perfumes or deodorants in them. All these three things will alter the normal bacterial flora of the vagina. The vagina keeps itself protected from infections by, first is the acidity, second is by having a normal bacterial flora of its own, and there are healthy lactobacilli in the vagina. So when we use vaginal washes which are having antibiotics or having harsh chemicals or deodorants, there can be irritation, there can be allergy, and that bacterial flora, it dies off because of the antibiotics. So the harmful bacteria get a chance to infect the vagina. So vaginal washes should not be used regularly. They should be used occasionally. So what are the circumstances in which vaginal washes should be used? First is that you can use vaginal washes in those situations where the vagina's pH is altered. That is during menstruation. During menstruation, you can use a mild vaginal wash which is pH balanced, which does not have any fragrances, any antibiotics in it. Use those vaginal washes because at this time there is blood which is there, it is altering the pH of the vagina. So use vaginal washes at that time. Vaginal washes should be used after unprotected sex because semen also alters the pH of the vagina. It should be used in cases where there's hot and humid climate. There's a lot of moisture, there is a lot of sweating. In those circumstances, V washes can be used. And fourth is where a lady is exercising and sweating. So where there is sweating happening and you feel that you're uncomfortable and you want to wash that area, then in those circumstances, you can use V washes. So V washes should be used in those four circumstances. Apart from this, it should be used occasionally. It should not be made into a regular habit. But the genitalia has to be washed and it has to be washed with plain water. There should be no douching. Douching is introduction of water or introduction of washes inside the vagina. That should never happen. There should be no douching, and you should try to keep that area. When you wash that area, you should remember that the movement of the hands should be from front to back and not from back to front when we are washing. Because when we move the hands from back to front while washing, we are actually introducing bacteria from the anal area into the vagina. So while washing, the movement of the hand should always be from front to back. Now, the next thing that we should always remember is wear clean and breathable cotton underwear so that the sweat, when it comes, it is easily dries up. It is not trapped over there, and you should not wear tight or synthetic underwear ever. Then what other things that we should do as part of menstrual hygiene plan? One is that once the period products have been removed, it is very, very important to wrap it in newspaper and put it in a dustbin with a lid. Because what is happening is that your period products are introducing infection into the household. If you're not disposing them correctly, they will introduce infection inside the household. So you have to wrap it properly, put it in a dustbin with a lid and discard it. Next is that we should not flush sanitary products in the toilet. It is very imperative not to do it because it can clog the drains and create trouble in your house. Another most important thing which needs to be done and which is a must is you should always have a tracking of your menstrual cycle. Tracking of the menstrual cycle is in two ways. First is you can use an app to track your menstrual cycle. Second is use a calendar. How do you track your menstrual cycle? The day your periods come is day one of the cycle. So you mark it in the calendar and you keep marking and you see when your next cycle comes, when is next day one. And this way, what happens is that the moment you delay, periods get delayed, your periods get missed, you have irregular periods, you'll come to know in time. Sometimes what happens is that people have regular cycles, but since they have not marked it, they start thinking that, oh my God, my periods are not regular. But when they mark it correctly, they find out that usually it falls between the 21 to 35 day range. And sometimes what happens is that women have irregular periods, but since they're not tracking it, they do not understand, or they miss out when the periods get delayed or when the periods get missed. So it is important to make sure that you're marking your menstrual cycle on a calendar. And what is most important is you should not ignore any heavy bleeding, as I have mentioned, that any bleeding in which you need to change your pads every 1 to 1.5 hours, any bleeding which is having heavy clots, any lower abdominal pain which is of that level that it is affecting your functioning. In those circumstances, or any irregular periods, you should go and visit a gynecologist. So this covers our menstrual hygiene do's and don'ts. And the conclusion is that if we remain informed, we remain aware, we can all be period positive, and it is easier for us to pass through our periods in a healthy manner this way. So now I would like to invite any questions if there are regarding menstrual hygiene, do's and don'ts, and whys. Any question about vaginal washes?
Yes, Dr. Meera, your presentation was really a wonderful set that you presented, and it's really going to help our students, help our girls. Uh, it's actually my question is out of the context. I was reading this thing that some of the states that they are giving this menstrual leave policy, like in Bihar, in Kerala, and in Odisha also. They have introduced this menstrual leave for 1 or 2 days, and that's the paid leave. So I was just thinking that is it required, or what is your take on it, ma'am? That uh, is it important, or it should be there, or what is your opinion on this menstrual leave? Since
My
we are
personal
talking on this area, that's why I'm talking about that.
My personal opinion is that definitely there should be a leave, which is menstrual leave for 1 or 2 days, but and that is because it gives a lot of relief to women, because they
Yes.
sometimes, what happens is that most of the girls find it very difficult to express what they are passing through. They might be having heavy periods, but they find it very difficult to
Yes.
tell it to their employers. They find it very difficult to share it to their colleagues that today I will not be able to work much because I'm having discomfort in my lower abdomen, or I'm having heavy periods right now, I'm feeling weakness right now, or I'm not feeling quite up to it. So it will help those women and those girls who find it difficult to express that they're having trouble. But of course, there is 1% chance that there are people who might just use it the other way. In those
Yes, they can.
circumstances, it is always my advice that if it is possible, they can get a medical certificate from a doctor and take a leave. But otherwise, also understanding women, because I worked for so long in this field, understanding women, I find it that it will always be beneficial for them to get that 1 or 2 days off so that they can get relief during that time.
Thank you. Thank you so
But it
much.
should not, become a source of shame for them.
Yes, it's
That they should not be
this is
shamed
there.
for taking it.
This is there. Thank you. Thank you so much. Thank you, ma'am.
Yeah, of course,
I
yes,
hope
Dr.
the
Meera, like
girls.
people, girls and women, they should not believe in body shaming. Every girl goes through periods, and as you said, the pH of the body fluids, also the blood changes. So, every girl, every woman should be very, should understand her body, and we should accept our bodies. Also, there was one thing, Dr. Meera, uh, apart from dysmenorrhea, girls and women also sometimes go through amenorrhea, lesser
Yes.
periods, very
Yes.
lesser flow. So, is that also very normal part of the menstrual cycle?
So that is what I said, Sumitra ma'am. What is there is that there are two things. First is the menstrual cycle is very easily affected by stress. It is a hormonal cycle. A slight imbalance in the hormones of the body creates an imbalance in the menstrual cycle. And that is why we have a range of the menstrual cycle, like 21 to 35 days, 2 to 7 days. So even if it is coming in after 21 days, it is normal. If it is coming after 35 days, it is also normal. If it is coming for 2 days, it is also normal. If it is coming for 7 days, also it is normal. So we have ranges because it is a body, and a body works according to the circumstances or the environment also. Apart from genetics, a lot of role is played by the environment in our lives. And I've seen this personally also, that whenever women pass through stresses, or they find that, I was not able to sleep properly at night, their hormone cycles get disturbed very easily. So in this case, what is required is that, yes, scanty menstruation is there, but scanty menstruation or amenorrhea is a condition which has a lot of causes behind it, apart from hormonal imbalances. It can be because of certain infections, it can be because of certain conditions. And scanty menstruation should also not be ignored. Like heavy periods should not be ignored, scanty menstruation and amenorrhea should not be ignored at all. Most of the times, there are just causes like thyroid or tuberculosis. These are also very common causes for scanty menstruation, or even anemia. Anemia is a big cause for scanty menstruation. So it is important that whenever there is scanty menstruation or amenorrhea in that condition, you should go and visit a doctor and find out the cause so that you can treat the cause.
Very well said, ma'am. In the same context, I would like to inform you, like you are based in Noida, in the government hospital. So we, as with our legal literacy committee, we've been to various villages in and around Noida, and we have distributed free sanitary pads to everyone, and have, yeah, and we try to spread menstrual awareness. Thank you, Dr. Meera. Now I'll request you to please make all of us aware also about HIV/AIDS. Over to you, Dr. Meera.
Okay. So first, I would like to ask if there is any other questions which are there, which your audience is having.
I'll request audience to put up questions to Dr. Meera. You can type it in the chat box and maybe ma'am can take it together. Yeah, thank you. Dr. Meera, over to you.
So this is amazing that everybody has understood this topic well. And so we will go forward with HIV/AIDS awareness. And HIV/AIDS awareness is another topic which is very, very understated topic. People do not talk about it very openly, but this is very important to talk about HIV/AIDS. Now let's first start with what is HIV/AIDS. Now this is something which people do not know, is that what is the difference between HIV and AIDS. HIV is a virus. It is called human immunodeficiency virus. This virus attacks our body's defense system. Like any other viral infection, this also, due to certain reasons, we get exposed to it. This virus enters the body, it attacks the body cells, it starts multiplying within the body, and it causes disease. So in this infection, when you get exposed, when anybody gets exposed to HIV infection, the virus enters the body, and its most important thing is that it affects the cells. It attacks the cells of the body which are important for defense mechanism, which are important for the body's immunity. And once it attacks the immune system of the body, specifically if it attacks the CD4 helper T cells. So what happens is that the number of the CD4 cells starts dropping, and the number of the viruses, it starts increasing in the body, and a certain level is reached when symptoms start appearing. So the last stage of these symptoms is called AIDS. When a person has AIDS, it is the last stage of the disease. It's called acquired immunodeficiency syndrome, or AIDS. It is the final stage. So any person who is having an HIV infection may not be having AIDS, but every person who is having AIDS will be having an HIV infection. So this is the difference between HIV and AIDS. Now, why is awareness so important for HIV? First is because for HIV, there is no known cure. Of course, it is a treatable disease. Treatable in the sense treatment is available for this disease. You can take treatment. Anybody who is having HIV can take the treatment, live a long life, healthy life, but he will never be truly rid of the virus. So there is no known cure for HIV. That is why HIV awareness is important. Prevention is better than cure because there is no cure. Second thing, why is awareness important in HIV? Because a person may have HIV and that person may not show any symptoms for a long period of time. Here, I would like to break a myth which is usually there, is that most people think that you can look at a person and tell whether the person is having HIV. No, you cannot look at a person and tell whether the person is having HIV. A person with HIV for many years, he may not exhibit any symptoms of the disease. And in In that condition, when he is having HIV infection, not exhibiting any symptoms, that person is still contagious. He can still transmit the virus. The second thing which is about HIV is HIV has a long window period. A window period is a time period between infection to when the tests come positive. So once a person contracts HIV, the period when the tests start coming positive is 15 days to 3 months. Till 3 months, a person may not exhibit any symptoms. A person's tests might be negative. Person may still be having HIV, and he will be transmitting the virus to other people without them knowing that they are contracting HIV from this person. So because of these reasons, HIV is something about which awareness is required and prevention is also required. Now, if we go to the next stage, which is there, is how is HIV transmitted? Now, this is very, very important because there are a lot of myths which are surrounding how is HIV transmitted. HIV is transmitted specifically through body fluids. And when we talk about body fluids, not all body fluids are contagious. The body fluids which are contagious is semen. Semen is very contagious. Vaginal fluids are contagious. Rectal fluids are contagious. So if we look at these three body fluids, we understand that HIV is thus transmitted through vaginal, anal, and oral sex. It can be transmitted because HIV infection or HIV virus persists in the semen, vaginal fluids, and rectal fluids. Then if we come to the next body fluid, which is highly contagious, which transmits HIV, it is blood. So if we look at blood, the method of exposure to blood can be if a person is like an IV drug abuser and he uses needles or syringes, because mostly in drug abusers, people share needles and syringes. And because of sharing of needles and syringes, it is a very unsafe practice. The exposure to an infected blood can take place, and that is how HIV can be transmitted through blood. Another way is through blood transfusions, but usually blood transfusion is done in a very, very safe practice manner after a lot of screening. So there are less chances through blood transfusion, but there are greater chances through sharing of needles and syringes amongst drug abusers or amongst people who are not aware that they need to change their syringes or needles. Next method, next body fluid through which HIV is transmitted is breast milk and amniotic fluid. So if you think of breast milk and amniotic fluid, this is a vertical method of HIV transmission, as in from a mother to a child during pregnancy. Again, because we all know HIV is a condition in which the symptoms may not appear for a long period of time, the tests may not be positive for a long period of time. So a person may get pregnant and maybe having a child and not knowing that they are passing on the HIV to their baby. Now, again, there are a lot of myths concerning how is HIV transmitted, but actually it is not being transmitted through sweat. So since it is not transmitted through sweat, you cannot catch HIV by sharing a bed, by sharing bed sheets, towels, or clothes of an HIV positive person. You cannot have HIV. Second is through tears. Third is saliva. So there is a myth कि झूठे बर्तन के अंदर खाने से या फिर बाद में food share करने से या sharing utensils with a person who's HIV positive, you cannot be HIV positive. Next is through urine and feces. So now there is this myth which is associated that you can get HIV through toilet seats. No, we cannot get HIV through toilet seats because firstly, urine and feces do not carry the virus. Second is the virus is very, very fragile. It cannot stay in the external environment for long periods of time. So the moment it comes out in the external environment from the body, it dies off. It cannot be infective anymore. So because of these reasons, you cannot get HIV through sharing of clothes, bed or bed sheets, through sharing food, handshake, hugging, or even toilet seats, as is a common myth. But however, one thing is to be remembered, since HIV gets transmitted very easily through blood. If any of these body fluids like sweat or urine or feces or saliva is having blood mixed in it, these fluids immediately become a source of infection of HIV. So I would like to invite any questions if they are there so that I can move on to the next slide if there are none.
No questions, but yes, an observation, Dr. Meera. So, like we all travel to different places and use public washrooms also. So, I think when we use the public washrooms, we should ensure that it is clean.
Yes.
Yeah, and try to sanitize the place. Sanitizers are
Yes.
now available everywhere in public washrooms.
So I'd like to take this opportunity, and we'll veer a little off topic here. We will talk about toilet seats because this topic has come up. Yes, toilet seats are a big source of infection. Toilet seats are a big source of bacterial infections. They are a big source of fungal infections. People can contract sexually transmitted diseases through toilet seats, and toilet seats can also be a big source of skin diseases also. But what another thing which needs to be remembered here is not just the toilet seats, the handles, the flush, whatever you touch in a common public bathroom, everything can be infected, can be contaminated with bacteria or viruses. So this is another thing which should be remembered. So yes, the safest and best practice is to carry a toilet seat sanitizer whenever you have to go to a public washroom, because of course all of us, we do travel to work, we are in malls or we are in shopping places, and we do share common bathrooms. It is a very, very good practice to carry a toilet seat sanitizer, apply it on the toilet seat, and wait for 5-10 seconds for the sanitizer to work and dry, and then you use the toilet seat. It's a good practice. But along with it, another practice which should be used is washing hands after using the washroom, because apart from the toilet seat, we have touched the doorknobs, we have touched the faucets, we have touched the flush, so we need to wash our hands. Yes, a toilet seat is a big source of infections, and we need to be careful.
Okay, ma'am, thank you. We'll request you to proceed, please.
Now, the next thing that is there, just as I've said, just to reiterate, how is it transmitted and how it is not transmitted. So it is transmitted through unprotected sex. It is transmitted through infected injection equipment, again, sharing of needles or syringes. Accidental puncture by needles, usually this is an occupational exposure to doctors and surgeons or people working, health workers. Then pregnancy, blood transfusions, very rarely so. And if you go to a place where they are not using good hygiene practices, they are not using good medical practices, and they are non-sterile tools, so anything which is contaminated with blood, which is having semen, vaginal, anal secretions attached to them, they can cause HIV. And how is HIV not transmitted? Since HIV is not present in saliva, it cannot be transmitted through kisses. So closed mouth kissing, but it can be transmitted through kissing if there are blisters in the mouth or sores in the mouth or ulcers in the mouth, and then there is contact through blood in the saliva. So that is one way. Second is by touching or shaking hands or hugging a person with HIV. It is not transmitted. Mosquitoes or other insects cannot transmit HIV. Like mosquitoes and other insects can transfer malaria, dengue, but they cannot transfer HIV. Food and drinks, sharing food, drink articles, sharing utensils with a suspected HIV positive patient will not cause HIV. Through air or water. Now, this is sneezing or coughing. If a person who is a suspected HIV case or even an HIV positive case, there is sneezing, there is coughing, there are no chances of it getting transmitted at all. Toilets or bathroom, because HIV virus cannot live outside the body for long periods of time. So toilets and bathroom, the moment it gets exposed to the external environment, it dies off. And so HIV cannot be transmitted through toilets and bathroom. But yes, there are other lot of infections which can get transmitted, which we have to be careful about. So moving over to who is at risk. Now, connected to how it is being transmitted, we can easily find out which are the high risk groups. High risk groups is anyone who is sexually active without protection, any person with multiple partners, people who share needles like drugs, tattoos, or piercings. So whenever you go to a tattoo parlor, whenever you go for piercings, even whenever you go to salons, be very careful to make sure that they are using sterile instruments, they are using sterile needles, that they are using all kinds of sterile instruments or autoclave products to do the tattoo, do the piercing. Even in the salon, if someone goes for a shave, then be careful that the razor has been changed. babies born to HIV positive mothers who are without treatment. These are people who are at risk. Now, here I would like to give an example that this is where people who are at risk, they have a chance to protect themselves from HIV by using pre-exposure prophylaxis. So we have pre-exposure prophylaxis available for people who are at risk, who are IV drug abusers, who have multiple sexual partners, who are commercial sex workers. These people can use pre-exposure prophylaxis. Pre-exposure means before exposure to HIV. They can take medicines which are antiretroviral therapy. They can start taking those medicines. They can keep taking those medicines till the period of time that they are exposed. So usually what happens is that they have to be HIV negative. Suppose there is a person who is now currently with a partner who has a history of multiple sexual partners. So now you are worried that this person might be HIV positive, and for 3 months I might not get a test from this person which is showing me that this person is HIV positive. So how for the next 3 months you can protect yourself? You can use a pre-exposure prophylaxis. You can go to a doctor. It has to be taken under doctor's supervision. You have to be HIV negative at the time of taking the medicine. You start taking the medicines until the time that there is an exposure. They keep taking the antiretroviral therapy and they keep getting tested for HIV every 3 months. This is how pre-exposure prophylaxis helps in people who are at risk. So if there are any questions, I'd like to ask if there are any other questions which need addressed here.
We'll proceed, Dr. Meera.
I hope I was clear about
Yeah, very
pre-exposure.
clear. Yes.
So now we come to a day-to-day breakup of how signs and symptoms of HIV develop. Suppose there is a person and she feels or he feels that he has come in contact with a person who might be having a suspicion of HIV, or that person might have come in contact with a needle which might be contaminated with HIV positive blood or which was a non-sterile instrument. What and how should the person proceed in life? What are the signs and symptoms they should look for? So after exposure to a suspected case or contact of HIV, within 24 hours, the next day, there will be no symptoms of HIV in that person. If the person wants to get a blood test done to find out whether she or he has contracted HIV from the suspected case, then there is no blood test which will give a positive result at this time within 24 hours. But important is that you get a blood test of the contact. If the contact is known, the person with whom that needle has been shared or syringe has been shared is known, or the person, your partner is known, then in that case, get the blood test of the partner done. And if you find out that that blood test is positive, now you should start post-exposure prophylaxis. Post-exposure prophylaxis is after exposure to an HIV positive person. You are not aware, but it was a positive person. So you can start post-exposure prophylaxis. It has to be started as soon as possible within 72 hours. And within 3 days, post-exposure prophylaxis should be started. This is again antiretroviral treatment, which has to be taken under doctor's supervision for 1 month. If the blood test of the partner is negative, then the blood test has to be repeated after 2 to 3 weeks again, because a person can have HIV and still test negative from a period of 15 days to 3 months. So a person can be in the window period and you have to repeat the test after 2 to 3 weeks. After day 3, that is after 72 hours also, there will still be no symptoms of HIV. There is no way that you can detect that you have contracted HIV from someone either through symptoms or blood test. Now it is a week since the exposure to a suspected case. A week after exposure also, there will be no symptoms. But you can, and you are very much you want to get a blood test done, you want to make sure that you have not contracted. So the blood test which is available is the blood test for viral RNA. This is not the regular blood test of HIV, which is regularly done in labs. It's a different type of blood test which can be done to detect viral RNA in the blood. If it is found that the blood test is negative, you still need to get a repeat test done after 2 to 3 weeks. And if it is positive, you need to start ERT. Now it has been about 2 weeks to 1 month. after the suspected exposure to HIV. At this time, any person who has contracted HIV will start having acute phase symptoms. Acute phase symptoms will be symptoms which are very similar to a viral infection, like a sore throat, fever, body aches, headache, tiredness. These are all the symptoms which start happening, but these are very common and very vague and very subtle symptoms. Simply on the basis of symptoms, nobody can say that this person is having HIV. At this time, about a month after the exposure, you should get blood tests done. And if the blood tests are positive, it is time to start antiretroviral therapy. ART is the type of therapy which will make sure that the virus which is in the blood, it is it stops replicating. It is arrested from multiplying in the blood. It is arrested from spreading and destroying more of the immune cells of the body. So an antiretroviral therapy helps in stopping the progression of disease. The disease will progress. The disease will not be cured, but the disease can be slowed down at this time by starting antiretroviral therapy at the right time. Second is, if the blood test is not negative, but you are still suspicious that you have come in contact with someone who might be HIV positive, then you repeat the test after 2 to 3 weeks. This means that every time there is a exposure, every 1.5 months, every 2 months, you keep getting yourself tested till 3 months. Till 3 months, at 3 months after the exposure, if you're still negative, then there are fairly good chances that you never contracted HIV. Next is that suppose a month has passed and a person has contracted HIV. Now, what is the next phase of the disease? This is the chronic phase of the disease. 1 month after exposure on contracting HIV, the person will start having symptoms. Symptoms will be weight loss. Symptoms will be diarrhea, weakness. That diarrhea will be a diarrhea which is lasting for more than 1 month. Mouth mein there will be oral sores, ulcers on the mouth. There are repeatedly the person is getting infections again and again. There are herpes sores. Usually this is the time when a person is detected with HIV. They go to the hospital with the diarrhea, oral sores, that I am having repeated infections. And then when a doctor gets them tested, incidentally it is found that they have become HIV positive. Now what happens is that this chronic phase of disease continues. It continues, and the time of continuation, the progression now depends upon the person's health, as if the person's immunity, how fast it is deteriorating. If the person has started antiretroviral therapy at the right time, the disease progression will be very slow. Person can keep having, just be in the chronic phase of disease, may not reach AIDS at all, the final stage at all. But what happens is that if the person is not taking antiretroviral therapy, here what is happening, the virus will keep multiplying, keep destroying the immune cells. And once the immune cell level falls below 200, the final stage of AIDS is reached. The final stage of AIDS, what happens is the person starts having all the sorts of infections which a normal human body can never have, like fungal infections of the brain, fungal infection of lung, pneumonia, tuberculosis, even cancers. And AIDS is the end stage of disease. Once the CD4 cell counts start falling, it is very difficult to get them to rise again. Once the viral load starts increasing, it is very difficult to get them to stop. If antiretroviral therapy or treatment is started at the right time, the viral load will be less, transmissibility or the contagiousness of the disease will be less, the immune cells will remain high, and the person may just stay in the chronic phase of the disease. But if a person likes to stay in denial and not take the therapy, and that way they will reach AIDS, which is the end stage of the disease. So here I would like to give an example about post-exposure prophylaxis, because this is often given to us as doctors or surgeons. It is like this, that if a doctor, and I'm explaining the progression of the disease through this example, if a doctor gets a needle prick, like let me give you my example. I was on the 7th of November last year, I was doing a surgery. I got pricked by the needle while suturing the uterus. When I got pricked by the needle, it is direct contact with blood of the patient. And when I took the history of the patient was having a husband who's a truck driver. Now, truck drivers are considered to be people who are at high risk. They are having, usually they are on the road, they have multiple sexual partners. They're supposed to be very high risk for AIDS. And she herself had got 3-4 blood transfusions. Now, the first step which was done is that even before surgery, we usually get the HIV test of the patient blood. So the contact is known. Now there is a suspicion of exposure to HIV. The contact's HIV was negative. I got my HIV test done, and within an hour after completing the surgery, I started post-exposure prophylaxis with antiretroviral therapy, which was given for a period of 1 month. I had to take one pill, which had a combination of 3 drugs for 1 day each for 30 days. I started that treatment. I was tested for HIV at that time, which was negative. That HIV test was repeated after 1.5 months. After the stoppage of the treatment, 1.5 months later, it was negative. It was then again repeated 3 months after the exposure, like 7th November onwards, 3 months after, it was again negative. And then it was again repeated 6 months after the procedure. So 6 months now is like somewhere in May, 7th May, I got tested and it was negative. So after 6 months of repeated testing, now I'm sure that I was exposed, but I did not catch the virus. And in that, post-exposure prophylaxis helps. Same way, you can change the scenario that a person may get exposed not by an occupational exposure, maybe because of IV drug abuse or maybe some other suspected way. But this is usually the way that we go about in post-exposure prophylaxis. And if a person does not take post-exposure prophylaxis or misses it out or goes in denial, then the entire process of HIV might take place. So I would like to ask if there are any questions at this point.
Oh, no, with your own example, I think we need to be very careful about these things. And also,
Yes.
Dr. Meera, did you take any medication for that?
Yes, I took antiretroviral therapy. I took
Okay.
post-exposure prophylaxis for that.
Okay.
And yes, and they are very strict about it, that you have to take that medication, you have to take it within 72 hours. I completed the course of 1 month, and still, even after completing the course, I kept getting tested.
Right. Okay.
So
Dr.
it was
Meera,
only after 6 months of
yeah,
negative
exposed.
HIV test that I was completely off the hook. That now I'm like completely clear.
Okay, great. Nice.
So this is how easy. This is how easy it is to get in touch or get in touch with somebody who's suspected case of HIV or to just get exposed to HIV.
Yeah, and
So we have
anybody
to be
can
very
get
aware.
into that. Anybody can catch that. With the example that you've given and also with the prior information that you gave, people at high risks are always there. Yes, Dr. Meera.
So if there are no further questions, we'll move over to the next slide.
Yeah.
Now, what is important? What is important is prevention is power. Prevention is power because we all know HIV does not have a cure. It can just be treated, symptoms can be treated, but it does not have a cure. So the prevention which we need to do is have protected sex all the time. Use condoms every time, whether it's male or female. Second is get tested regularly. If you find that if somebody finds that they're in the high risk group, they need to get tested every 3 months. So get tested regularly for HIV. Do not share needles or razors. Again, if you're going to a tattoo parlor, going for piercing, going for salons, be very careful to make sure that they're using fresh needles, they're using fresh instruments, they're using everything which is fresh. Next is encourage your partners also to get tested. There is no shame in getting tested at all. And consider pre-exposure prophylaxis if a person is at high risk. Again, the people who are at high risk may consider a pre-exposure prophylaxis of antiretroviral therapy that is started on a doctor's advice and that is continued till the exposure is there. Now going over to the next thing, it is treatment. Treatment is of course antiretroviral therapy. Antiretroviral therapy is very, very important. If a person is HIV positive, there is no shame, person should not hide it. It is his personal choice that whether he wants to tell other people or not, but at least he should tell his partner, firstly. Second, that person should get a treatment, proper treatment. And that treatment makes sure that the viral load, that if we are taking antiretroviral therapy at the right time and properly, it will be very effective in reducing viral load. If the viral load is less, then the transmissibility of the virus to people who are healthy around the patient is also very low. And it will make sure that the immune cells do not fall, so that the disease progression is very slow. People on antiretroviral therapy can live long and normal lives. So at the end, there are 5 ways that we can help end HIV/AIDS. First is to know the facts about HIV and AIDS. Number 2 is always to talk, start the conversation. There is no shame, stigma, or taboo attached to asking about HIV/AIDS or talking about it. Protect. Protection is very important for yourself and for those you love. Test. If you think you are in a high risk group, then you need to get your blood test done every 3 months. Know your status. And there is no shame in asking your partner also for his or her status. And lastly, treat. Stay healthy and protect others. So now I would like to welcome any questions regarding HIV/AIDS that.
Yes. So now let's have a huge round of applause for Dr. Meera Pathak. Beautifully,
Thank you so much.
very beautifully narrated, and the narrative that you set in the beginning together for menstrual hygiene and AIDS awareness was really very powerful. And also that prevention is power is one big term that we take away today. So I'll request my girl students and learned female professors if they have any questions for Dr. Meera. So if there are no questions, I would like to share this certificate of honor. Just a moment. Just a moment. Dr. Meera, this is the certificate of honor presented to you. Can you see that on screen?
Let me check.
Yeah. Monica ma'am, can you see that?
It's not visible, Dr.
I
Sumitra.
can see the screen. Maksud sir, can you see my
Yes,
screen?
now it's visible.
Yes, ma'am.
Okay, so this certificate of honor is
Thank you
very,
so
very
much.
proudly presented to Dr. Meera Pathak in recognition of your valuable guest lecture on menstrual hygiene and AIDS awareness. These are the topics which people talk about, but they seldom talk about. They are not aware that their body is what they have. You should be proud of your body. You should respect your body. As our honorable prime minister says, जान भी चाहिए और जहान भी चाहिए. पहले ये था ना कि जान है तो जहान है, नहीं, जान भी चाहिए, जहान भी चाहिए. So certificate of honor is presented to Dr. Meera Pathak, held on for the guest lecture on menstrual hygiene and AIDS awareness on 18th of June by Amity Legal Literacy and Outreach Committee with Girl Up Gauravi in collaboration with Legal Aid and Literacy Committee at the Law School, University of Jammu. We sincerely appreciate your time to give us a guest lecture on menstrual hygiene and AIDS awareness. This is with great respect and gratitude, Dr. Meera Pathak. Thank you. Our founder president, Dr. Ashok K. Chauhan sir, always blesses us to conduct such literacy programs. I will now request Monica Narang ma'am, who is associate professor at the Law School, University of Jammu, to present the concluding remarks. Dr. Monica Narang.
Thank you, Sumitra. It's really been a very wonderful interaction, and what Dr. Meera Pathak has given a extensive information on this menstrual hygiene as well as AIDS. So this is very important for a say good living, for a healthy living. So it was a wonderful information for all of us. Thanks a lot, and I again congratulate Amity Law School, Dr. Meera and Dr. Sumitra, and you're all organizers and the whole legal aid committee. From on behalf of the law school, I thank you also for organizing this program. So it's been a wonderful evening for all of us. Thanks a lot. Thanks. Thank you.
Thank you, Dr. Monica Narang, once again. Thank you, everybody who's taken out time to attend this guest lecture come interactive session with Dr. Meera Pathak, a very young and dynamic doctor in Noida,
Yes.
who is working with the government and spreading literacy on menstrual hygiene together with us, Amity Legal Literacy and Awareness Committee. It is said that padhi likhi jo ghar ki nari Ho Kutumbaki Shiksha Sari. So, with today's lecture, you have educated all of us. Thank you, Dr. Meera Pathak, once again. Thank you all for being a part of this guest lecture. We will meet soon on some other platform with some other topic, making the country aware, educating everyone so that together we can contribute towards Viksit Bharat. And our Chancellor, Honorable Chancellor Dr. Atul Chauhan sir says that towards Viksit Bharat, the maximum contribution should be from the Amitians. And also, we as women and girls, we foster the women-led development. Thank you so much for joining us.
Thank
Bye-bye,
you so much
everyone.
for having me here. It was a great pleasure and an honor to be here amongst all of you. It was a wonderful session, and it was a wonderful session and for me also.
You got a great compliment from ma'am, Dr. Bhavna Batra, who says Dr. Meera's voice is a force, where is it? Yeah, Dr. Meera's voice. Where is it? Can you see that? Just one moment. Is there anything that anybody would like to talk about? I will request everybody to hold your breath because our honorable founder president, Dr. Ashok K. Chauhan sir is here. Sir has seen the entire guest lecture and the interactive session. I'm feeling so excited. And also it is because of his blessings and his love for Amity Law School, of course, that we get every kind of support from founder president, Dr. Ashok K. Chauhan sir. Sir is joining. So he has already joined us. He's opening up his camera now and he will be speaking to us. So, Dr. Meera, you've got great compliments. Dr. Balmiki Prasad has complimented. Sir has been a surgeon at Safdarjung Hospital in Delhi for your outstanding presentation and remarks. Beautiful. So, Dr. Meera, uh, I mean, you remain very busy throughout the day along with your medical profession as well as these literacy programs.
No, it is just a great pleasure to be here. It was an amazing session for me also. It's always a joy to be part of awareness programs to spread the knowledge, to spread the awareness. Has always been a passion of mine. So it was a great pleasure for me.
Okay, so sir is going to address us for a few minutes. So till that time, is there anyone who would like to speak up? Any of our students, Ruchita? Any of our faculty members? Student Niharika. Niharika is also a member of Girl Up Gauravi. So we've also partnered with a United Nations campaign, Girl Up Gauravi, which says that when girls rise, we all rise. So as girls and women, we have to rise. Waiting for Honorable Founder President, Dr. Ashok K. Chauhan. Monica, ma'am, so do you also organize such lectures?
We are organizing, but it's been a long time that, uh, yes, previously we
So much of
organized.
academic work,
Yes,
लेकिन काम
yes,
बहुत ज्यादा है, लेकिन हमारा ध्येय हमेशा ये रहेगा कि हम लोगों को अवेयर कराते रहे. So
of
part of
course.
yeah. Oh, it's great to have our honorable founder president. Pranam sir, good evening. On behalf of the entire Amity Legal Literacy and Outreach Committee, over to you, founder president, Dr. Ashok K. Chauhan sir.
Sumitra, I started from the very beginning and till thank you, I saw it because this is something exceptional program. Only you can do it with your fantasy, with your innovation, with your love for education and all those who have addressed here. Really, I would like to read about them. I would like to know more about them. There are so many programs, but this is an exceptional program for families, for newly married, for girls, for women. So I think I will show it to the many persons at the campus and other universities, and you will, as always, navigate it. But my compliment to all those who have spoken, and also the honor you gave to one of the guests here. I appreciate them, and but sometimes you give me more details about all those who addressed and all those who attended. And Bhavna was very active here, and all those who are actively engaged in this program. I would like to more, and we can really do it more times at all our MIT universities for students, women students. So my blessing, my compliment. It was a really wonderful program, and all those who have participated, my blessing, my compliment. And again, Sumitra, what you do is always exceptional, unique. So my blessings to all. No, all the best. All the best.
Thank you so much, sir. We are so beholden that you are here. I'll just ask Dr. Meera Pathak to speak to 2-3 lines about our honorable founder president, sir.
I saw her getting the award. I read the full text of the award.
Oh, wow.
Thank you so much. It was an honor to be here. To be part of this session has been an honor for me. And it's a joy to meet you. And I'm really, really very grateful to the entire organizing committee for inviting me here, making me part of this session. And it is a joy as always. Thank you so much.
Meera, tell a little about you, about your background, about your professional. I'm very eager to know more about you.
Sir, I am MBBS MS Gynae. I have done my post-graduation and graduation from Rohtak Medical College in Haryana.
Right.
And I have been senior medical officer. I have been with the UP government Department of Health and Family Welfare for the
Right.
last 14 odd years now. And I am very, I participate a lot in all the awareness programs, interactive sessions that I can find because I love to spread awareness. And I have also been part of media panels and expert health.
Right.
I have been part of a lot of print interviews and media interviews regarding health as a health expert and part of the medical panel. So it is a great. I'm really grateful to Sumitra ji for giving me this opportunity to be here today, to be part of this session here. Thank you so much, and thank you, sir. It
Well,
was a
Haryana
joy
is
to
very-
be part of this.
Haryana is very close to my heart because my wife is not from Haryana, but she studied in the university there when we married. She was just finishing her MA in Sanskrit, topped the college, and I came from Germany and just picked up and taken her. This was year 1972. So, Sumitra, you know that Amitaji is from that university in Haryana.
Yes, sir, I know.
Smithy, University of Kurukshetra. So I think all those are Haryana like my family member or studied there. Good. I would say again my compliment. और मीरा जी को अगली बार बुलाएंगे फिर कभी भी मीरा पाठक
बिल्कुल बिल्कुल सर मैं तो I'll be blessed. Thank you so much.
Thank
Very
you so
blessed
much,
and
founder.
grateful.
So once again, thank you so much, everyone. So as I say that पढ़ी लिखी जो घर की नारी हो कुटुंब की शिक्षा सारी स्वस्थ बेटी से ही बनेगा स्वस्थ भारत और स्वस्थ बेटियों से ही बढ़ेगा भारत का मान. Thank you so much, everybody, for being here. We'll meet again.
सुमित्रा क्या सेंटेंस है कौन कहता है सुमित्रा बुलाती तो फाउंडर प्रेसिडेंट आते नहीं
सर ऐसा नहीं हो सकता मैं बुलाऊंगी तो आप जरूर आएंगे ऐसा मेरा विश्वास है
मेरे 4 प्रोग्राम और चल रहे थे तो टुगेदर विद द 4 आई वाज लुकिंग आल्सो दिस प्रोग्राम गुड नाइस थैंक यू
सर आपके आने से हम सबका हौसला बढ़ा थैंक यू सर रियली ब्लेस्ड
थैंक यू
थैंक यू सो एवरीवन पढ़ी लिखी जो घर की नारी हो